Hello, everyone. And welcome to today. We're just waiting for our guest to come on. Fantastic. Hello, sis.
Good evening.
Good evening. I can't see you. Oh, there you are. Oh, wow.
Hi.
Look at you.
How are you? Good to see you.
Can you hear me?
I can hear you. Can you hear me?
Yeah, I can hear you perfectly.
Oh, okay.
Fantastic.
Good.
Right. So I'm just going to introduce you, and then I'm going
Okay.
to hand over to you basically. And then any questions I have, we will flow with it. This is just like a normal sisterly
Like
conversation.
chat.
Hey,
Okay.
so
I like that.
so everyone, global sororitas, everyone that's going to join us, we have a phenomenal woman here today by the name of Tolani Balogun. Tolani is the founder and senior consultant of Hepaiconsulting,
Mhm,
specialising in pelvic floor disorder and dysfunction. She's an
mhm,
expert. Let me tell you, she is an expert and a specialist practitioner in pelvic floor dysfunctions. As a coach and a trainer, she has a passion for women's health and is an ardent advocate for women's mental health. She's affectionately referred to as the pelvic health guru. Trust me, by the time she start laying down all the facts and information, you know why they call her the pelvic health guru. She's also an author of the Pelvic Floor Exercise Quick Guide, and she developed Pevtone, which is a device to enhance pelvic floor muscle toning and vagina strengthening. She's also created Pre-Love, a specialized underwear for heavy periods and urinary leaks. She is also the founder of Healthy Living, which is a Nigerian registered NGO. And the mission is to close the gap on health disparities, encourage inclusion, and offer educational training. And her NGO has impacted more than 10,000 individuals. Isn't that fantastic? And one of our projects raised awareness around menstrual health and hygiene. The fund raised from this awareness campaign contributed to supplying teenage girls with menstrual
mhm.
pads. So today, she is not just an entrepreneur, she is not just a phenomenal woman, she is a mother as well to two amazing girls. Tolani, welcome. Welcome,
Thank
welcome, welcome.
you.
So,
Thank you very much, man.
yes, so I've given you the introduction, but I wanted to hand over to you and just tell us a little
Okay.
bit about yourself. Who are
Okay.
you? And so people, our viewers can get a little bit more. Yeah.
All right. I think you've said it all, but I'll just go deeper, what's not in the CV. So right, like you've rightly said, my name is Tolani Balogun. I'm a pelvic floor specialist practitioner, and I have a consulting firm which is called Empire Consulting, and we deal with anything pelvic health. But with my NGO, we do give advice, awareness, prevention of diseases, a lot of education around health generally. So we're not limited that one to pelvic floor health with the NGO. And the reason being, we want it inclusively, we want it to be an inclusion thing. And that's why the name says healthy living for all people, which means both male, female, adult children are very, very inclusive. So it doesn't really matter what that is.
Mm.
I started as my first university. I went to university in Nigeria actually, and I started with banking and finance. So it's not like nurse, from the beginning. So it was banking and finance. Came to London 20 years ago. I did marketing for like a year. Then when I got married, I wanted to study law. right? So it has nothing to do with nursing. So, but you know, marriage and all that, law, I want to do law, no, you can't do law and all that. So we pushed that for like 2, 3 years with me getting admission, you know, to study law and everything. But I just left that on hold and I came into nursing. And then, yeah, and here I am. When I started as a nurse, I started as a kidney transplant nurse. So I have experience within the kidney transplant patient that just had a newly transplant. We tend to prep them. And I have experience with urology patients as well. So I have urology background. I have a background of head and neck cancer. So people with laryngectomy, tracheostomy care, I can do this as well. So when I left there, I felt like, oh, I want more. You know, I've always been wanting more right from a youngest age. So I went into renal research. And when I got to renal research, I just felt like, oh, it's too boring, you know, it's a lot of data, facts, and all that. You still see patients in clinic, but it was a little bit boring. So that was how I came into pelvic health. So yeah, and here I am today. So
Mm,
I'm still the pelvic floor, you know, field. And yes, that's
fantastic.
just the
Oh,
little thing.
yeah. So, right. So, what would you say is the why were you so passionate about it? Because when you talk about it, you're very, very passionate about it, and I want to know a little bit more about that.
Right. So pelvic floor health is
Mm,
something that I think one of the reasons why I'm passionate about it is the fact that I've seen quite a lot of people, you know, during
mm,
my practice and within the clinic as well, suffering from all this problem. And I've noticed a trend that most people tend to ignore their symptoms in the first phase of the problem. And the reason being that we've always seen pelvic floor health as something that, oh, it's something that you don't say to anybody. You know, it's a taboo word. You don't mention anything sexual health outside. You don't mention anything that related to your bowel or anything that related to your bladder. So nobody wants to talk about these things. And if you look at it vividly, when we're growing up, nobody has ever taught us and say, oh, KG, you know what? There's something called toileting techniques. You know, even we as mom will just put the kids there in the toilet, close the door, and ask them when you finish, let me know. Meanwhile, ordinary poor toileting technique can have an impact on the pelvic health at a later stage, whether you're a man or a woman. So aside that, I realized that there's a higher number of women, especially women that are mothers, you know, that have pelvic floor issues because pelvic floor is a complex area. And when I say complex area, I mean complex area, right? It's not just one organ that you can just say, okay, I have a pain in my nose. And then it's quite easy to diagnose like that. We're talking about an area whereby you have different kind of organs sitting there, which means if something is happening with this organ, it can easily has an impact on the other organ if care is
wow.
not taken or if we're not doing something. So because of the amount of data that we have and the total number of people that are actually suffering in silence, you know, this is one of the things, this is one of my own thing, like, okay, people shouldn't be suffering in silence. There's help. And it's okay to talk about pelvic health. Whether you are having pain during sexual intercourse or, you know, it's just okay, whether you're a man or woman. And there's another myth. People feel like every single time when you talk about pelvic, we just automatically think about women. And not only women, you think about pregnant women or women that are just having a baby, right?
Mm,
So the women that had baby like 35 years ago, 40 years ago, nobody is thinking about their pelvic health anymore. Meanwhile, we have quite a larger number of this category of people, right, that are suffering from pelvic floor dysfunction, which is actually affecting their day-to-day activities or is actually having a very massive impact on their health and both mentally, psychologically, socially, you know, impacts on their health. And do I
mm,
tell you about the number of men that comes to the clinic with pelvic floor dysfunction? So for those who are watching us today, I just felt like, oh, I don't have any symptoms, you know, I've not had a baby, or whether you have a baby or you don't have a baby, or you're a man, as long as you have bladder, you have a bowel, right? You can easily have a pelvic floor dysfunction and it can develop at any time. So this is one of the reasons why I really have a passion, because when you have a lot of knowledge about something and you know there is help and people are suffering on a daily basis, it's just, I just feel like no, we just have to raise the awareness and let people know that, you know what, there's help and it's okay to talk about pelvic floor. I can talk about pelvic floor anytime. I can talk about sexual health anywhere. I can talk about bladder, bowel, constipation, incontinence. It doesn't matter. It's just an organ like your heart, like your, like every other organ in the body. So one thing that I would say today is, please, guys, it's okay to talk about pelvic health. And we all need to advocate for that so that we can break that taboo around this problem. Thank you.
Fantastic. Fantastic. I love that. I love that. I love that. And it's like every other, you know, social issues that we have, right? Or mental issues that we have that we don't want to speak about, but we're suffering in silence. And that's the reason why I really appreciate what you're doing.
Thank you.
So in the journey of having a healthy pelvic, functioning bits. What is it? What is it? Is it when you start getting symptoms, or would you say it's something that we all need to start looking at? We will go to the gym. Is this something that we all should start focusing on now, or should we wait till we start having some kind of symptoms? And what are those symptoms?
Right. Thank you so much for that question. So if I can hear you clearly, the first question was, do we have to start, looking after our pelvic health, or do we have to wait for symptoms? What I always say to people is, prevention is better than cure. Anytime, any day, right? It's always better to prevent something from happening or occurring than you trying to fix it. Because sometimes you might be able to fix it, but not 100%. Sometimes you might be able to fix it only 50%. And other time you might not even be able to fix it because it now becomes unfixable, because people weren't talking when the help were there, or when things can be done easily, right? So that is one. So with pelvic floor health is something that we really need to look after every single day, whether you're a man, whether you're a woman. And one of the reasons why I'm saying this and I'm stressing it is, I know for a fact, okay, that 40% or even more of people that suffer from pelvic floor dysfunction later develop a kind of depression or mental health issue. Because it affects a lot of people to the extent that they don't leave their house. People are losing their jobs, right? Because they can't go to work. People are losing their partner. So there's a lot of marriage breakup, relationship breakup due to so many things. So many people cannot even tell their partner, right, that I'm having this issue. This is why I don't like sex. Some can't tell their woman that it's because I'm having erectile dysfunction, which could be due to pelvic floor weakness, that this is why I'm running away from home. Meanwhile, the partner doesn't know. These are real life stories I'm telling you, right? So the woman doesn't even know that husband is suffering from erectile dysfunction. So therefore, the men will wait for the woman to go to bed before they come home. Then the woman will now like, oh, it's because he's cheating, he's not coming home on time when he comes, and the man is judging. Exactly the same thing. Women do that as well. So during sex, they're having pain, they're having all this, they're not talking, they're not communicating. So the partner doesn't know. Or somebody that goes to work and all of a sudden they're having leakages. You know how that can be so embarrassing. So because of that, people are so scared even to socialize. People are not leaving their house. People can't go to work. So it's really affecting the mental state of health. And that's why I'm stressing it, that if you have pelvic floor dysfunction, it's okay to talk. And like you asked me, it is something that we need to look after every single day. And the good thing about pelvic floor is the pelvic floor, right, we have is like a component, right? Let me use my hand to do this demonstration. So let's say this is the pelvic floor frame, right? We have the pelvic floor muscle is like an hammock that support all these fragile organs that we have. So for women, we have multiple organs. We have like additional organs that men don't have because we have reproductive organs, right? So every single of these organs can dysfunction. And if you remember, I said they are within the compartments, right? All this organ, they're within this compartment of this frame. So you have the uterus there, you have the vagina there, okay? You have the bladder, the smaller intestine, the larger intestine, and all these organs can actually prolapse. So you don't wait until you are pregnant to start looking after your pelvic health, because that is the meat of the 21st century. And average women, we hear about the importance of their pelvic health the first time that they're getting pregnant. In fact, most women that I know, they will say to me, "Oh, Tolani, you know, the first time I heard about pelvic health, so my midwife told me that I need to look after my health." It shouldn't be. And one of the reasons why we're not having this thing aware is because of the awareness. The awareness is not there. We're shining away from all this area because we felt like it's something that we shouldn't be talking about. Is rude. You can't talk about toilet. You can't talk about bladder anyhow. You can't talk about sexual health. People will be like, oh, gross. Oh, that. No, it's just like any other organ. So please don't wait until you're pregnant or after you're pregnant before you start looking after your health. And can I say to women, especially those that have had baby like 30 years ago, 25 years ago, you need to be looking after your pelvic health as if you've just had baby today. Because the truth is, as we grow older as well, there's a high chance or tendency that the pelvic floor can get weaker with age. Because we have so many reasons or cofactors that people can have pelvic floor dysfunction, like you have, right? So one of the reasons is age, whether you're a man or a woman. The older you get, the higher risk you have of having pelvic floor dysfunction or pelvic floor weakness, which can result to incontinence, whether urinary incontinence or fecal incontinence or stress incontinence, right? That's just one. Another symptoms is what we call surgical related. So whether you're a woman that have had any gynecological surgery, hysterectomy, for example, that's very common. Okay, if you had hysterectomy and you're not looking after your pelvic floor, whether it's a year after, 10 years after, 5 years after, all of a sudden you can just realize, oh, you're having these new symptoms building up. It is very common. Any pelvic surgery, gynecological surgery, trust me, this can cause pelvic floor dysfunction, right? So for women, when you are now pregnant, because every single time when we're pregnant, the weight of the baby, do you remember I said the hammock is, the muscle, the pelvic floor muscle coordinates the bladder, the bowel, and sexual health. So the weight of the baby now is an additional on the organs that the pelvic floor is trying to support, right? So that is another weight that is added to what is on ground before. Yes. So if we're not looking after that, there's a high chance that can easily get weaker, right? So that is why you can see that most midwives will tell a pregnant woman, oh, you need to start looking after your pelvic floor. So pregnancy is another one. Another cause is what we call when a woman is actually having babies or when they had a baby, if they have third-degree tears. There's something we call third-degree tears, or they have fourth-degree tears, or the baby is big and they have to use like a faucet to get the baby out, okay? All these things are contributing factors to developing pelvic floor dysfunction.
Yeah.
So now, let me now come to women that say, oh, but Tolani, why did I have this problem? I have a lot of instructors, gym instructors, that have pelvic floor dysfunction. And if you're a gym fanatic, because we preach, when we're preaching about health, people will tell you, exercise, eat healthy. Nobody will come to you and say, oh, after you've eaten healthy, are you defecating regularly? Right? Are you suffering from constipation? Nobody asks these questions. And it's as important. Can you see? So we preach, eat healthy, but nobody's asking the waste product, is it coming out? Because most pelvic floor dysfunction can either cause constipation, leakages, incontinence, and all that. So people are not asking. We're only preaching one side that we are comfortable to preach rather than check the whole holistic thing. Because if we're talking about health, it has to be holistic.
Yes.
And what I mean by holistic is, let's look at, first of all, we're eating healthy, we're exercising, and at the same time, are we sleeping enough? Are we defecating? Can we control the bladder? Can we control the bowel? Is there any issue around this area? Nobody is saying anything about this. And these are the things that we really need to do. Exercise. You know, if you're, let's say you're bearing down, when you're doing squatting, a lot of people go to gym, especially ladies these days. They want to have a bit of, hips and all that, right? So they tend to do a lot of squatting. If you're squatting as a lady, whether you're a gym instructor or, or not, if you're squatting, and every time you're squatting, you're bearing down on your pelvic, which means you're putting strain on the pelvic, there's a high chance you can develop pelvic floor dysfunction, pelvic floor weakness, rectal organ prolapse, because your technique is wrong. It's good that you're exercising, but when you're exercising wrongly or incorrectly, then there's an impact on your health again. And this is what I'm trying to tell people. So there is one thing to say, healthy living is good for you. There's another thing to check. Are you actually practicing the healthy living correctly? Because they're two different things.
Yes.
So this is why I think a lot of people that are women that have never had babies with pelvic floor dysfunction. So yes, anybody at all can have pelvic floor dysfunction as long as you have pelvic floor organs. As long as you have a bladder, you have a bowel, you have sexual organs, trust me, you can have pelvic floor dysfunction. And please do not wait for symptoms to develop before you start looking after your pelvic floor. Thank you.
Oh, wow. Fantastic, fantastic, fantastic. So the question that comes to my mind is this.
Okay.
How do we learn the right technique, right?
Okay.
And that's important, isn't it? And also, with your consultancy, when someone comes to you and say, okay, you know what, I want to start looking after myself. I want to have a holistic plan in terms of my health. How do you work with them? So 2 questions. Okay. How do we know the right way to exercise, right? Or to look after our pelvic health? And if they come to you in terms of seeking help, how do you work with them?
Okay. So the first one, I'm going to answer the first one first, right? So if I'm going to work with anybody, it has to be like an individual. It is always individual care plan, right? Because you can have 2 people coming to you with similar symptoms, but trust me, the cause of the symptoms might be different. So I say to people, every single time somebody walks in to say, Tolani, I'm having this problem, whether it's leakages, whether it's incontinence, whether it's defecatory issue, which I will explain, I don't want any jargon today, whether it's difficult defecation, whether it's an obstructive issue, first of all, what I want to know is what is the root cause? Because every single symptoms that they've mentioned, or the reason why they've referred them to me in the first place, right? Those are indicators. They are indicators. They are symptoms. And they are pointers. They are pointing to us that something within the GI area, something is wrong. So I'm going to give you a very quick example. Right. So if you come to me and say, Tolani, I'm suffering from constipation, for example. Yeah? Most times when you suffer from constipation, the GP, the medics, or whoever is looking after such patient will first of all try what we call laxatives, medication that can make the fecal content soft or that can make them to go to the toilet.
Yes.
Remember, if it is chronic constipation, and what I mean by chronic constipation, it means that you've been having constipation longer than 6 months or more than 3 months. right? And it means that without using laxative or trying some other stuff, you can't really go, or you're having very difficult, difficult defecation. If that happens, what I want to know is laxative is okay. It's good. I'm not saying it's not good, but I want to know the root cause. Why is the he or she having constipation issue in the first place?
Right.
Were they born like that? Because you can be born with what we call slow transiting, right? And slow transiting simply means, if you look at the anatomy of the larger colon, right, is somewhere from my right, so your bottom right, the right side of your abdomen, it goes up, and that's why we refer to it as an ascending colon. I don't know if you can see this. I will have explained it with it, right? So if somebody is having slow transiting, a lot of people can be born that way. So if they are born with slow transiting, it means that the time the waste product gets into the larger bowel, it takes longer time to move from the point of deposition to travel around before it gets into the rectum, right? So if that is the case, that means multiple people within that family will have constipatory issue, right? And that will have been happening since they were young. So the kind of treatment we will give somebody like that will be so different. Because even if you give them laxative, that will not prevent the slow transiting from occurring because they were born with slow transiting.
Right.
Yeah? People that are not born with slow transiting can actually develop slow transiting when they have, e.g., surgery, childbirth, every single thing that we've talked about.
Yes.
3rd-degree tears, 4th-degree tears, they can have slow transiting. So you want to know the root cause. So when you now know the root cause, you will now know how to target the root cause and say, what can we do to get the root cause better, whether we are preventing it from getting worse now, or how can we treat it so that it's not having enormous impact on such individual. Like I said to you, 2 people can come with constipation. Some people, it could just be techniques. Some people, it could just be their anatomy. So therefore, we'll go through, what are your symptoms? I want to know your social history. I want to know everything that you do that can be a contributing factor. I want to know your medical history as well. Because if you look at the whole body, every single thing works together. Every single thing is linked one way or the other. Whether we like it or not, it is linked. Right? So that is one thing. So everybody will be taken as an individual and, be assessed to now determine what is the goal plan for such person. Right? So what is the second question? Because I'm thinking I don't want to mix it now. So what's the second question?
How do we find out how to do the right exercises to help us?
Right. Thank you very much. So it's okay to do pelvic floor exercises, but I'm just going to drop this information. It's not every single person that actually needs pelvic floor toning as well. Because some people have issue with hypertonic pelvic. And what I mean is they are not relaxing. If you see a man or a woman that has anxiety, right? Problem with anxiety, stressed, tensed, I can guarantee you, most of the time, they will have pelvic floor dysfunction.
Right.
Do you know why? Because we have what we call core muscles, right? And our pelvic floor, the way they work is, there's a lot of transmitters of messages around the muscle. If you want to defecate, for example, if you want to wee now, right, we need to get a message from the brain that will tell us, you know what, your bladder is full. Then we now have the urge. Then we now go to wee, for example. That is why you see when people have problem with sensation, if they don't have sensation anymore due to accidents, or they have stroke, paralysis, therefore the messages cannot go through or filter through, then you will see that people will just have accidents and they're leaking and it's uncontrollable. They don't know because there's a default within the transmitters of the messages. And the way these messages are being carried out for all these organs to work effectively, the organs can actually dictate whether somebody is anxious, tensed, or stressed. So when you are anxious, instead of you to go to the toilet and do whatever it is that you want to do, right, you will realize that you will start contracting instead of the pelvic floor to relax. Because if you're going to defecate or you're going to wee, for example, you need your bladder to be relaxed or your bowel to be relaxed. Then you open, you defecate, you close, right? But if you're contracting because of anxiety, or you are constricting, because if you look at the pelvic floor, have you ever wondered why it's so easy for women to have this baby head as big as this coming out, and all of a sudden it's closed up again, almost instantly? Yeah, it's because it's a muscle, and that muscle is so flexible that you can stretch it, right? It's a very stretchable muscle. It's like when you have a rubber band. You know what's called rubber band?
Yes, yes.
Do you know what rubber band? Yeah. So if you pull the rubber band, yeah, you know you can stretch it.
Of course,
right?
yes.
And when you leave it, it goes pump again. That is how the pelvic floor is, right? So it's quite stretchable. So when they are getting these messages, they can contract or they can constrict. And every single time they are contracting or they are constricting, they can cause other issue around the other organs that are within that area because it is abnormal. Remember, we spoke about poor techniques.
Yes.
Because naturally, that is not how that organ should be functioned at that particular time. So a lot of people with anxiety, for example, we have this problem. Yeah. So it is very, very complex. If honestly, if we go from today to tomorrow, we will just keep breaking them on, and it's so complex. So that's just it. It's just so complex.
Wow. Wow. This wow. This is so important. You know, I think there's a saying that the body keeps the score. That means everything and the experiences you've gone through, your body's recording everything. And that's the reason why it's so important to continue.
Yeah.
It's like a journey, isn't it? You continue to look
Yeah.
after yourself. So,
Yeah.
right. Oh my goodness.
So before you go to the next question, the question you have me.
Yeah.
We need to do pelvic floor exercise. And if anybody here is actually interested, they can go, on my website. It's free. I've done a step-by-step guide for both men and women to do their pelvic floor exercise. So they can go on my website, subscribe, and they will get it free. And not only that, they can be getting weekly, newsletter around different types of diseases that, with pelvic floor. We're talking about organ prolapsing. We're talking about different things that could occur within the pelvic floor, whether it's pre-birth or postpartum, right? Whether it's for man or woman, there's a lot of things that they will be able to get from that. However, like I said before, it's not everybody, because this is why assessments has to take place. There are some people that have this hypertonic muscle, like I said to you. So they are contracting, they are constricting. And this is why you see some people during sexual intercourse with their partner, right? They feel really tight. It's like a struggle, right? So it's very, very painful. So they have to use different techniques. Sexual time is not fun for them at all, because they have hypertonic muscle. They are they are contracting, they're constricting, everything is too tight, they are not relaxing. There's something we call anismus. If you are so anxious that you have anismus, it will be so difficult for you to be able to defecate easily. And that is why you go to the toilet, you see some people, they will have to push. Going to toilets and pushing or straining is wrong.
Right.
It is a wrong technique. And if you do that consistently for the next 6 months, I can guarantee you, before you know it, you will have one kind of organ prolapsing or the other. And this can happen to men or women. So sometimes straining techniques can be the reason why a woman is having a rectal wall prolapse, for example, or a man. Sometimes you hear that, oh, this woman has what we call a rectocele. Is another type, is the anterior part. It could be the anterior part or the posterior. What I mean by the anterior is the frontal part or the back part. You know, it still has to do with your bowel, your bladder, because every of the organ that we're talking about can prolapse. Every single organ. The bladder can prolapse. I've seen a woman, right? In fact, a lot of women coming, their bladder is prolapsing, right? They have rectal wall prolapse, okay? They have a rectocele, the uterus is prolapsing, the larger colon is prolapsing, the smaller intestine is prolapsing at the same time. What do you think is going to happen to such women?
Wow.
Of course, they will have leakages. They will have incontinence issues. They will have pain issues. They will have defecatory issues. They will have obstructive issues. And the truth is, there's a lot of people that are going through this problem, but people are not saying anything because the society, the culture, even we, the people, we're not encouraging it because we felt like it's a taboo thing. It's something that nobody should talk about. It's so private that we're covering up. It's so private that nobody says anything until it starts to affect their day-to-day activities.
Yeah.
But a lot of people will need to do pelvic floor exercise. But if you feel like you fell into a category whereby you feel like you're so tight, that you're always tight, rather than anything else, please see a physiotherapy, see a pelvic floor specialist, let them check so that they can give you appropriate exercise. Because what I do with that category of patients is to teach them actually how to relax their pelvic floor first, right? Before we can start toning up the pelvic floor muscle. Because if somebody is going really hard, right, even when they need to wee, they will be retaining. And before you know it, they are having retention of urine. So all these things are so complex that they can cause different kind of issues. For men, they can have erectile dysfunction. You know, and some people don't know that it's just because the pelvic floor is weak. That's why 1 minute erecting is good. The next minute, oh, they're having problem with erection. And they won't say anything. Men will not say anything until things are getting worse and worse. And that's the truth. Even women don't say anything because we felt like it is too private. Right? I have a lot of physicians, and I'm talking about medics, that have exactly the same problem. I have nurses, I have physios, so it has nothing to do with hygiene. As long as you're not doing something right, you can have these problems. And I said problems because it could be dysfunctions or a dysfunction. Remember, it's a very complex area.
Yes.
And that's why people really need to start taking it serious.
Yes.
Whether you've had babies 30 years ago, 40 years ago, or yesterday, we all need to look after our pelvic health. Whether you're a man or a woman, it doesn't matter. Thank you.
Thank you. Wow. Do you see a lot of women that's had children come to you?
Oh.
I'm just trying to see, yeah, because when I think of like a C-section, which is quite a serious operation, and someone like myself has had C-section 3 times, you know, and you're thinking, how does that impact the muscles? How does that impact my pelvic area? You know, those are the questions that sometimes go through my mind. Do you tend to see women who've had children and had you know, operation or surgery come to you a lot more?
Okay. If you remember, I said something. I said pelvic floor dysfunction can be developed as a result of any gynecological surgery. And I mean any gynecological surgery and any pelvic floor surgery. So whether you have cesarean birth, right, that doesn't mean that you cannot have pelvic floor dysfunction. You still need to look after your pelvic. I've seen quite a lot of women that has no kids with pelvic floor dysfunction, with organ prolapsing. If you remember, I said, even men, right, that don't get pregnant at all, they do have pelvic floor dysfunction. As long as you have a bladder, you have a bowel, sexual health is there, right? you can have pelvic floor dysfunction. You can have pelvic floor dysfunction due to poor techniques, whether it's poor toileting techniques, whether it's poor lifting, whether it's poor exercise techniques. Anybody can have pelvic floor dysfunction, including
Fantastic.
women that have their babies with cesarean. Yes, it is very
Fantastic.
common.
Fantastic. So you've heard, look, there's so much information and so much nuggets that I've taken out of this conversation, and I think it's important. I've pinned Tolani's website on here, and I'm going to post all her, all her contact details and her Instagram IG handle on the video when I upload it. So it is important to get in touch with her and speak to her on a one-to-one basis. She's very, you can see that she's knowledgeable, she has years of experience, and she knows what she's talking about. So I just wanted to talk a little bit about your NGO.
Okay.
And what was the inspiration behind that, and why did you start it?
Right. So, starting my NGO, there are two things for me. Naturally, when I was growing up, I've always been a very compassionate human being. That's the way I am, right? I'm very, very compassionate. I don't pretend. It's not like when I'm doing something for people, I'm doing it because I want something back. And most times, I actually do things for people that cannot repay me. So if I can remember vividly, as young as 7, 8, 9, I've always ensured that every single of my clothes I can wear, I go to the street, look for people that are less. I've always been like that. And I remember my mom always says something to me in Yoruba, in my language, like, hey, one day this girl, I hope she's not going to put me into trouble because she will just bring anybody's children into my house, that one day she won't enter properly. I've always been like that. So, I've always, as a young child, looking out for people that I felt like I can help. That is one. Another thing is, I lost my sister, right? I lost my sister, my immediate elder sister, in 2013. And shortly after that, I lost my brother's wife. Again, they both died in Nigeria, I was here. Okay? And the circumstances that surrounds the death, right? They are actually issues that could have been prevented. If people are self-aware, and that is what I said to people. I keep saying it, and I will say it, that prevention is better than cure. I'm not saying it because it's an adage that people say. I'm saying it because I know the importance of that word. So it is better to prevent a thing from occurring rather than wait till the time that you will have to treat that thing. Unfortunately, when it comes to health, right, a lot of people will rather neglect anything health. I don't know whether you've been, with your program, you will have seen that every time you're doing anything health program, you will see quite a number of people. If it is a program that you're doing about let's get rich quick, you will see a large multitude of people. But what people are forgetting is health is the master of wealth. Because I've seen quite a large number of people that are rich, but their richness cannot help them. And the thing about health is it can deteriorate just like that anytime. And that is why it is important for people to realize the importance of their health and take it, as something that is very important. So me starting my NGO is because of, one, being compassionate is my passion. It gives me satisfaction to see somebody getting better. And two, I lost two people very dear to me, very close to me, because the awareness is not there, right? Prevention is not there. Even the people that are ought to look after them, most people are not retrained. They are not following them up. Like yearly, 6 monthly. They need to be checking, okay, what the training you had 5 years ago. There's a lot of research, a lot of new evidence. not getting retrained. And unfortunately, people are dying. People are dying, you know, with things that, you know, is preventable. And it's really
Yes.
sad.
Yes.
In this area where I am right now, is better. It's better. Because there's a lot of research, there's a lot of awareness and all that, right? But in some other parts of the country, in some other part of the continent, the story is so different. Recently in March, this March, I was in Nigeria in March to raise an awareness. And trust me, I was asking men, and I said, how many of the men knows the function of their prostates and even the location of the prostates? Nobody got it right. And it's not because I'm in Africa. Because every single time I do the same thing here in the UK, we are getting exactly the same kind of result, which means 90% of people are not even aware of their organ or the function. So if you're not, how are you going to complain or present when you get to your medics? To say, okay, I'm having problem here. Because remember, there are some, for example, the pelvic floor is a complex area. If you come to me, I'm having pelvic pain, I can tell you 50 reasons why you can have pelvic pain. This is what people need to know. And this is why I started this, because in that area, I've lost 2 people dear to my life. And I said, you know, we can't wait for government to do everything. We are the government. If everybody is doing what they need to do, things will get better. If we are all doing, if what I know, I tell you, what you know, you're telling me, I'm aware, and everybody is doing the right thing, we will realize that this world is not as complex as it is. Yes. Most of the problem are problems that we are creating. And most times, a lot of people are ignorant. And ignorance itself is a disease, is a killer. Yes. For any society at all. Yes. And this is why I started the NGO. Wow. Starting the NGO wasn't easy. I funded it for like 7-8 years, you know, strictly with being a single mom, with my salary that is not even enough, but it's something that I want to do. And because I want to do it, I don't care. I don't, you know, I don't have to wear designer, and there's so many things that I had to forego to do that. And I'm happy that I do that, because every single time that I do that, I feel accomplished. You know, I feel accomplished. I remember when we went to do the menstrual hygiene course, you need to hear the teenagers. You need to hear them asking questions that, you know, they said to me that if we ask our mom this question, they will say, shut up. Where did you learn that from? And if you're not teaching the kids what to do, what not to do, they will learn it outside. If you as a mom cannot sit down with your daughter and say, okay, menstruation is expected, this is what you need to do, you know, be careful with guys, you don't do this because this can happen. If you feel like discussing that is an issue, whether you like it or not, whether they're learning it digitally or from friends, they will know, and that is the truth. Yeah. And if you're not giving them the right information, they will get the wrong information. And at the end of the day, you'll be the one running elter-skelter. These kids were crying. They were asking questions. And I gave them the room. I said, just ask me anything. And whatever we say today is here. So I was able to, you know, to mentor them, to point them to the right thing and tell them why this is wrong, why you cannot afford to do this, because if you do this, it will have an, you know, implication. Yes. You know, and this is why I do this. It's not easy, but we keep doing it, and we will continue to do it. Whether with support or no support, we will continue to do it. Oh, wow. Wow. Thank you. This is, you know, this is my language totally. Like, you know, I don't believe in just shouting about we need change. We are the change. You know, you become the change that you want to see. Thank you. So I'm so proud of what you've done. I'm so proud of you. And I just want you to tell our listeners, how can they support the NGO?
Is that how they can support you, or do they come directly to you if they want to support what you're doing?
Yeah, so they can contact me directly. The NGO, we have an account for the NGO. It's separate account. We don't touch
Right.
it. We only, yeah, so they can contact me. We have the bank account for that NGO. I don't even know it's offered really. I need to
That's
check.
okay.
Yeah, so they can contact me and then support us with anything at all. Our next plan now this year that we're trying to work on is on orphans, because one of my friends visited a community, and within that community, trust me, it was so. In fact, he sent me the video and he was crying. When children are actually struggling to eat, as in struggling to eat, in this day
Mm.
and age, you know, it's just it can get really overwhelming. So that's our net target now, to just to help community whereby they're really struggling, whether with food or materials and all that. That's the next thing that we want to do. And that's why our NGO is an inclusive thing. And that's why I said that it is an inclusive, it is called healthy living for all people, whether you're a child, whether you're a girl child, whether you're a boy child, whether you're a man, a woman, older generation, younger generation, it doesn't really matter, as long
Mm.
as we can help. Because
Yes.
I know every information that we're putting out there, as long as it's evidence-based, can always save someone. So, yeah, thank you.
Wow. It's been a quite a sobering conversation. There's a lot going through my mind when I'm listening to,
I know.
and yeah, I'm really, really, really grateful to have had the opportunity to speak to you today. And we're going
Thank
to
you.
post the recording on a platform and share it so that people can become more aware. And if you're able to kind of send me the details for the NGO,
I
um,
will do.
the the account details and things like that, so I can put it, and if people want to contribute, they can. So everyone, thank you for joining us today. It's been a fantastic time. I'm going to put Tolani's details when I upload this video. You can contact her directly. She's a lovely sister. You can see that. She's doing great work, and this is just the beginning. There's greater work to be achieved.
Amen.
So thank you, everyone. See you later.
Thank you.
Bye bye.
See you
Thank you, Tony.
later. Thank you.
Bye.
Cheers.
Bye. Bye.